You are the seed. You were designed for accomplishment. You were engineered for success and endowed with greatness. But just like life, you have to go through a process. And just like the seed, you are planted and watered, fed with the nutrients that you need. It's like having a dream and having a goal of wanting to be something. It has to go through the process. It has to be nurtured. And guess what? It's not going to be an easy road. It's not going to be a straight line to your dreams, to your goals, to your growth. Because the storms will come. The rains will come. The struggle will come. It's all about how you stand firm, never giving up, never backing down until you flourish, until you grow, until you achieve that goal, until you become that beautiful tree. You can do it. Have faith. You are watching RHD TV. We bring Ashanti Regional Health News and District News closer to you. Subscribe on our YouTube page, RHD Online TV. Follow us on Facebook, Ashanti Regional Health Directorate, and RHD TV.
Keep on watching RHD TV.
Introduce the dignitaries that we have among us. We will start with the U.S. Ambassador, HE Ambassador Stephany. Then we would also like to acknowledge our father of the region, the Ashanti Regional Minister, in the person of Honorable Simon Mensaha. Please give us a wave. Thank you. Then we would also like to introduce the Minister of Health, Minister of Health, PPME, sorry, Dr. Emmanuel Dami, please. Thank you. Then, Ghana Health Service Headquarters, the Director General of the whole country, Dr. DR.KUMA-ABOAGYE. Then we have the Noguchi Memorial Institute of Medical Research, EPIS, Ghana, which is led by the principal investigator for the secretary. He is in the person of Professor Ernest Fenu. Please, if you are here, please let us see you. Thank you.
The establishment of the Emergency Operations Center has come at a time when global health is threatened by COVID-19 and other epidemic-prone diseases that are occurring in other countries. For Ashanti Regional Health Directorate, we see this as an opportunity to improve upon our surveillance activities and response to diseases of public health importance and other events that threaten the health of the entire populace. We wish to welcome everybody to this very important occasion, especially Your Excellency, the Ambassador of U.S. to Ghana, our Director General, the Regional Minister, and other high-ranking officials who accompanied him to this very important function. Colleagues and invited guests, we deem it a very great opportunity to witness this day, and we thank you for being here. Thank you.
As we have witnessed from disease outbreaks around the world like Ebola, Zika, and COVID-19, preventing the spread of diseases has become a global concern, partly due to how our world has become so interconnected with worldwide travel and trade. Disease spread now advances from a local occurrence affecting a small village to a global pandemic in a single plane ride. Someone has a disease in the village, and the following morning he's in another country spreading the disease, unlike before. For this and many other reasons, the International Health Regulations, IHR 2005, require countries to develop, strengthen, and maintain their capacity to respond promptly and effectively for public health threats. A Public Health Emergency Operations Center, EOC, is an important requirement in this regard and serves as a central location for coordinating operational information and resources for strategic management of public health emergencies. Ladies and gentlemen, Ghana has established the National Public Health Emergency Operations Center with support from the international partners. However, the full functionality of the National Public Health Emergency Operations Center is hinged on the functionality and coordination of the Regional Public Health Emergency Operations Centers. The Regional Public Health Operations Centers, Emergency Operations Center, will provide real-time data from our districts and communities to support the quick decision-making at the regional and national levels. Like I said earlier, this is the third Regional Public Health Emergency Operations Center set up by the enhanced strategies to protect and improve health security in Ghana. Project that is in collaboration with the Ghana Health Service with support from CDC of the U.S. government. The first two, located in Takoradi, Sekendi, and Tambale, have been duly commissioned. Your Excellency, Madam Ambassador, I am glad to report that the two commissioned EOCs are being used to track various events in the respective region, including tracking the ongoing COVID-19 response and other epidemic-prone diseases such as meningitis, real-time monitoring of COVID-19 vaccination deployment in the respective regions, and thirdly, conducting the media scans to track rumors ongoing in the regions and in the communities. Additionally, there are plans to use the EOCs to conduct an after-action review of the yaws and scabies outbreaks that were investigated in the northern region. Your Excellency, Honorable Regional Minister, colleagues, stakeholders in the public health industry, if not for anything at all, the current COVID-19 pandemic has taught us the key lesson that a health threat anywhere is a health threat everywhere. And that is by working with other stakeholders, we can prevent outbreaks and ensure efficient and effective response to public health threats. In this regard, the Ghana Health Service will continue to work with the project to ensure the setup, maintenance, and sustainability of EOCs across the country to improve upon our ability to to prevent and effectively respond to public health threats. Distinguished invited guests, ladies and gentlemen, on today's occasion of the commission of the Ashanti Regional Public Health Emergency Operations Center, I entreat the Regional Director and his team to ensure that maintenance and effective use of the facility to benefit the region and beyond.
Ghana's response has overarching governing under the UAC roadmap and the national health policy. Ghana has defined universal health coverage as all people in Ghana having timely access to high-quality health services, irrespective of the ability to pay at the point of use. If you look at the definition closely, you realize that access has been qualified with timeliness. And this was done specifically because in the concept of emergencies, public health emergencies, clinical emergencies are like time is of the essence, and every second counts. Underneath these are three key objectives that underline the UAC roadmap. And one key objective is around enhancing responsiveness to public health and clinical emergencies. And that's why we consider this commission of the regional UAC as a quick traction in terms of moving the rhetoric into reality. The Ghana's response to the COVID-19 pandemic since the first 2 cases were recorded in March is really commendable, and we want to commend the Director General of the Ghana Health Service for his leadership around this. However, the increasing number of active cases and deaths in the 3rd weeks of the pandemic highlight the need to improve upon our response capabilities. Fundamental to this is the establishment of the Public Health Emergency Operating Center for coordinating operational information and resources for strategic management of the public health emergencies. I think the Director General in his speech made a point that really I captured, saying it will enhance quick decision making. And this calls into the fore 2 key attributes: agility and responsiveness in terms of how the center will operate. 3 regional UACs have been newly established at Takoradi Tamale, as was ably stated by the DG of the Ghana Health Service. With the support of the US CDC, and want to formally also commend the US government for this effort to the Republic in terms of moving our traction forward. This UAC really is the last of the 3 commissioned for use as a logistic command center in the Ashanti region, where all epidemiologic data will be collected and analyzed to help in the early detection of public health threats. This center will also coordinate information sharing and resources for effective response to our public health needs. Clearly, the lessons of COVID is telling us that we are in a moment where in the past we had what we call the known knowns, where we knew that if this cause happened, this was the effect and we could plan adequately. Then we got to the point where we're doing known unknowns, where it led to the same scenario planning. So you know, if this scenario happens, you go this way. If that scenario happens, you go the other way. Now clearly, what COVID and this pandemic is teaching us is that we are in the era of unknown unknowns. So we really don't even know what will happen and how we get ourselves prepared to counteract it. So clearly, it means that it's our ability to be agile, it's our ability to be responsive, it's our ability to be future thinking in terms of the world that we are all not very clear of. It is quite volatile, uncertain, complex, and ambiguous. And we need clear strategies and clear leadership to go around this. This will call for leadership around this that will be looking at effective results in terms of ideas and also getting implementation done. And we want to encourage the leadership of this UOC to look at this and think through the lenses to see how most people can be brought on board with various skills to be able to ensure that this leadership happens in this place. I want to reiterate again that we really highly commend the US CDC once again and the Ghana Health Service for sharing this beautiful and well-resourced UOC that we are commissioning today.
The Honorable Minister, the Regional Minister for the Ashanti, Her Excellency the Ambassador of the United States of America to Ghana, and your team, the Director General of Ghana Health Service, the Ashanti Regional Director of Health Services represented by the Deputy Director Public Health of the region, the Director Policy Planning and Monitoring and Evaluation of the Ministry of Health, Director Public Health, Ghana Health Service, the US CDC and other US government agencies have been great partners of the WHO over the years, sharing technical expertise, and foster collaboration on health priorities related to improving the health status of the African population. In 2016 to 2019, for example, the World Health Organization, working with the U.S. Centers for Disease Control and Prevention, through the Global Health Security Agenda Program, partnered to support Ghana strengthen its emergency preparedness. Local capacity was built in the community-based surveillance, integrated disease surveillance in the context of One Health. The rapid response teams were also trained and the national level emergency simulation exercises conducted. Indeed, these capacities placed Ghana in a better position to respond to health emergencies such as the ongoing COVID-19 pandemic. Distinguished ladies and gentlemen, the establishment of this regional public health emergency operations center here in the Ashanti region is pivotal to the coordination functions associated with emergency preparedness and emergency response, and is indeed crucial in enabling effective monitoring and response to events of public health importance, such as we've been reminded, the hemorrhagic fevers and cerebrospinal meningitis, which are prevalent in the sub-region. In the wake of the current COVID-19 pandemic and other threats in West African sub-region, Ghana more than ever needs such vital infrastructure to ensure that mobilization for and coordination of actual response to public health threats is efficiently executed within the context of country structures and available resources. I wish to take this opportunity to affirm the World Health Organization's commitment to continue working with partners like the U.S. CDC to help strengthen Ghana's capacities for health emergencies within the context of implementing the International Health Regulation 2005. We are happy to partner with the U.S. government and the U.S. CDC in training and other capacity building efforts towards this new center to ensure its full functionality and the achievement of maximum dividends from this investment. I wish to end by urging complete ownership of this facility by the Ghana Health Service and the Ashanti Regional Health Directorate. I encourage the Regional Director of Health Services to ensure its full utilization to the benefit of not only the Ashanti region, but other neighboring regions and other One Health partners in the Middle Belt. Once again, I commend the U.S. government and the CDC for this gesture and urge the Ghana Health Service and Ashanti region to utilize this facility for its intended purpose.
And Honorable Regional Minister, Mr. Simon Mensa, and Director General of the Ghana Health Service, Dr. Patrick Aboagye, and Director of the PPME of the Ministry of Health, Emmanuel Odame, Dr. Emmanuel Odame. Ashanti Regional Health Director, Dr. Emmanuel Tinkron, and WHO representative, Dr. Francis Castolo, and CDC GHS Program Director, Dr. Daniel Arada, and distinguished ladies and gentlemen. Good morning, everyone. Before I start, I'd like to introduce myself briefly. My name is Seung-min Oh, the new Senior Deputy Country Director of KOICA Ghana Office. I worked in Ghana before the 2017-2019. The memory in Ghana is very fruitful. The fruitful memory leads me to work again in Ghana for 3 more. I hope to frequently interact with many of you as we all collaborate to strengthen the Ghana's public health system. This is my first time to come to the Ashanti region, and what better way to come to this beautiful region than to participate in wonderful collaboration between the government of Ghana and the United States of America. On behalf of the KOICA Country Director and as a close partner of the both Ghana Health Service and the U.S. CDC, I want to congratulate the opening of the Ashanti Public Health Emergency Operations Center. I echo.
These centers are the result of collaboration between the United States government, the government of Ghana, the Noguchi Memorial Institute for Medical Research at the University of Ghana, and the Korean International Cooperation Agency. I know this center will serve an integral role in coordination and response to the current COVID-19 crisis and whatever public health threats emerge in the future. Along with Dr. Kuma-ABOAGYE, I inaugurated public health emergency operation centers in Sekondi in the western region and in Tamale in the northern region just a few weeks ago. Each of these centers significantly advances regional capacity in Ghana to track and respond to COVID-19 as well as to the inevitable future public health threats the world will face. The COVID-19 pandemic has made clear the need for localized public health capacity. Functional command and control centers like these are essential for the effective coordination of pandemic response strategies at all levels of the health system. We've seen throughout the pandemic the need to make data-driven decisions to be able to surge capacity and resources where and when needed. And this is why the establishment of public health emergency operation centers is one of the key strategies of the Global Health Security Agenda. The Global Health Security Agenda is a group of 70 countries, including Ghana, the Republic of Korea, and the United States of America, as well as international organizations and non-governmental organizations and private sector companies that have come together to achieve the vision of a world safe and secure from global health threats posed by infectious diseases. These new public health emergency operation centers are examples of how the U.S. government, through the Centers for Disease Control and Prevention, affectionately known as CDC, supports the health infrastructure and provides technical assistance on the ground. Regional EOCs are part of a sustainable approach to building a stronger public health infrastructure in Ghana. And these facilities serve to strengthen Ghana's response to COVID-19 and other emerging public health threats. CDC plays a leading role in implementing the U.S. government's global health security agenda through its work to prevent, detect, and respond to infectious disease threats. The U.S.-Ghana bilateral partnership has grown stronger through sharing technical expertise and improving critical infrastructure that has allowed Ghana to rapidly respond to COVID-19, control the pandemic, and save lives. After all, it's all about the people. I would like to commend the Ashanti Regional Minister and the Ghana Health Service Regional Health Directorate for their vision and leadership, as well as Noguchi and the Korean International Cooperation Agency for their continued collaboration. The United States stands with Ghana and Ghanaians in the fight against COVID-19. From vaccines to oxygen equipment and respiratory care to long-term health infrastructure investment and coordinated health information, we are as committed as ever to our robust, decades-long public health collaboration with Ghana. That's why the U.S. government has provided well over $30 million in support to Ghana during this pandemic. As others have said, our partnership with Ghana will not end when the pandemic ends. And it will end if we all continue to observe the COVID protocols and get vaccinated when the vaccine is available. Indeed, our work will continue as we build back a stronger and more resilient global economy and work together to combat health and other challenges in the future. We look forward to building on decades of partnership with the government of Ghana to strengthen its health system, including through the Global Health Security Agenda, the U.S. President's Malaria Initiative, and the U.S. President's Emergency Plan for AIDS Relief, known as PEPFAR. Thank you all for your kind attention.
With the greatest and unique opportunity that I join you here today in the opening of the Ashanti Region Public Health Emergency Operations Center, which is the third among two that have been earlier commissioned. That is one in Sekondi and the other in Tamale. We are very grateful to the sponsors, the supporters of this noble center, which is going to help a long way in improving the health systems and facilities in this country. It will enable captains at the health sector collect information quickly and enhance decision making in the health sector, especially where we have communicable diseases. I have no doubt in the strong collaboration between the United States of America and Ghana, which has been there for decades, and the great support we received from the United States. I take this opportunity, therefore, to commend the United States government and the U.S. CDC for again showing benevolence to us and helping us to acquire this particular center. We all realize the COVID-19 pandemic took the whole world by surprise, and every country was found wanting. But it affected some countries more than the other. The advent of the COVID-19 pandemic has exposed some weaknesses in our health systems. Therefore, the establishment of this Public Health Emergency Operations Center in Ashanti Region is received with a lot of gratitude. The government, realizing the weaknesses in the health systems, has now started an Agenda 111 policy, for which Ashanti Region, luckily, we are benefiting 16 of these facilities. Ashanti Region, unfortunately, most people don't know, is about the region with the least health facilities. Even though with its central location, most referrals are sent to Kofuanochi Teaching Hospital and some other hospitals. We therefore need, as people and government, to fill this need gap in the health sector. So we are grateful to the President also for the 16 hospitals, apart from some 5 for which sword was cut last year. If these are followed through and the facilities completed, it will improve upon our health facilities within the region. Your Excellency, the Director General of Ghana Health Services, distinguished ladies and gentlemen, now we are here celebrating the commissioning of this facility. That I'm urging those who will be operating the facility to take good care of them, keep the facility well, and practice best maintenance culture so that we can have the benefit of this facility for a long time. We don't want to hear that after 1 month or 2 months, this facility or this facility is broken down. So let's take good care of them so that those who have supported us to obtain this Public Health Emergency Operations Center will know the benefits of their resources. Once again, I express my sincere appreciation and gratitude to the U.S. government and U.S. CDC for the support, and pray that this cooperation should grow and be sustained. At this point, ladies and gentlemen, let's remember that COVID-19 is not over yet. The fight against the pandemic is not over yet. So please, let's all observe all the COVID protocols, good hygiene practices, and whenever the dose is available, we quickly go for them. Those of us who have not as yet received the jab. Thank you all for your kind attention. May the Almighty God bless us all. Thank you.
Sabre wo share RHD TV. Koswa na share na yebemo nsem bebre.
Spedele, starta gedele, mengele, otisare sedele, spedele, starta gedele, mengele, otisare sedele, enegis dabar kumshelele, midnight kelele, klago sebele, bula segele, enar on. Maradona tala rough. And you're on. Fagro tala rough. And I guess dabar kumshelele, midnight kelele, klago sebele, bula segele. And I guess dabar kumshelele, midnight kelele, klago sebele, bula segele. Yo, tiki yo, tiki yo. Yo, tiki yo, tiki yo. Yo, tiki yo, tiki yo.
This facility has been financed by the U.S. government through the Center for Disease Control, through the University of Ghana School of Public Health. The facility was renovated from roof to the very floor that we are standing on and refurbished. We have 10 computers here, 1 printer, and then a server. We have 3 monitors. It is furnished or fitted with a backup energy supply system, that's a solar system, which is in this case. It has a webcam or a video conferencing facility which sits on top of the bigger screen. The purpose of this center is to be able to early detect and respond to public health emergencies, including infectious disease. And we know we are battling COVID-19 now. So I just run you through how we're going to use this facility. The 10 computers here will be manned by 10 officers for different activities. An officer who will be in charge of data. We have an epidemiologist who will also be doing the day-to-day running of this facility. We have an officer who will be gathering data on other epidemic events like smallpox, which we know has been eradicated but we still have to keep an eye on it so that it wouldn't come to us as a surprise. We have an officer for One Health who is a veterinarian, and then a facility manager, and also, last but not the least, a health communication officer. All these officers will be working under Deputy Director of Public Health, who is himself a physician, epidemiologist with vast years of experience in managing disease outbreaks. I'll run you through how this system will be used. The first screen we see, this one, we are monitoring the global situation on COVID-19 because whatever happens outside impacts. You know what? So far as Ashanti Region is concerned, there are about 242 discussions about COVID-19 as of now that we are standing here. And about 267 people have responded. These discussions are going on the FM's social media platform, all the platforms across Ashanti Region. What are people talking about so far as COVID-19 is concerned? And what are people expressing? The positive side means what people are saying about COVID-19 is positive. And the negative means people have some negative sentiments. And COVID-19 covers every aspect of COVID-19, vaccination, the disease itself, deaths, everything. And we have the potential with these discussions, how many people can hear or access it. About 131,000 people can hear or access this discussion. So we can further go on to look at the themes. What are they discussing about, or what is featuring prominently? And we know KNUST Live, there's a program ongoing there about COVID-19. So we can track that and zoom down to find out what is it about, so that if we want to make any intervention, then we do.